Retroperitoneal space, as the name is self-explanatory. Retroperitoneal space lies posterior to the parietal peritoneum. It extends superiorly from the 12th thoracic vertebra and 12th rib up till down to the sacrum and the iliac crest of the hip bone below. This space lies posteriorly over the posterior abdominal wall, which forms the floor for the retroperitoneal space. And the floor for the retroperitoneal space, that is also called posterior abdominal wall in simple words, is formed from medial to lateral by the muscles, which include psoas muscles, both major and minor. Lateral to it lies the Quadratus Lumborum and origin of transversus abdominis muscle. All of these muscles anteriorly are covered by the continuous layer of the facial sheet that changes its name according to the muscles or the area that it is covering. In front of the facial layer, there is some amount of fatty connective tissue, which forms a bed for the organs that lie on the posterior abdominal wall, like the suprarenal glands, kidneys, ascending and descending parts of the colon, and duodenum. The retroperitoneal space also contains the ureters, the renal and gonadal blood vessels. Starting with some detail regarding the posterior abdominal wall. The posterior abdominal wall comprises of muscles, which I just mentioned. At least 5 muscles are said to be present in the posterior abdominal wall, which include the iliacus muscle, psoas major, psoas minor, quadratus lumborum, and superior most diaphragm. All of these muscles anteriorly are covered by the fascia. Now, this facial sheet that encloses or covers the anterior aspects of all these structures is one continuous facial sheet. This facial sheet lies between the parietal peritoneum anteriorly and muscles posteriorly. And this one continuous facial sheet is named as the fascia according to the structure that it covers or overlies. For example, starting with the psoas muscles, medial to lateral, we will go. You can see that this blue covering that you can see is the facial sheet. Now look closely. The fascia, which is covering the anterior aspect of the psoas muscle, will be labeled as psoas fascia. This psoas fascia is attached medially in the midline to the lumbar vertebra, and laterally you can see it is continuous with the thoracolumbar fascia, and inferiorly it is continuous with the facial sheet covering the iliacus muscle. So बेटा कहने का मकसद ये है कि जो फेशिया है पोस्टीरियर एब्डोमिनल वॉल का वो एक सिंगल कंटिन्यूअस शीट है, और ये सिंगल कंटिन्यूअस शीट ना सिर्फ पोस्टीरियर एब्डोमिनल वॉल में कंटिन्यूअस शीट है, ये सुपीरियरली भी पोस्टीरियर थोरैसिक वॉल को भी ये कवर करती है. सो इट इज एक्चुअली अ वन सिंगल कंटिन्यूअस शीट दैट इज एक्सटेंडिंग superiorly from the posterior thoracic wall till inferiorly up till the iliacus fascia. And it continues to rename itself according to the structures that it covers. जैसे कि हमने कहा कि जब ये श्वास मेजर को कवर कर रही है तो इसको यहाँ पे हम इस फेशिया को एक और नाम दे देंगे, श्वास फेशिया. इसी तरह जब ये लैटरली जाएगी और क्वाड्रेटिस लंबोरम को कवर करेगी तो वहां पे हम इसको सिंपली कह देंगे थोरैकोलंबर फेशिया. एंड जस्ट लाइक द फेशिया, जैसे कि आप लोगों ने पढ़ा था अपर लिम्ब में और लोअर लिम्ब में कि डीप फेशिया जो होता है वो रिस्पॉन्सिबल होता है फॉर द फॉर्मेशन ऑफ कंपार्टमेंट्स बाय सेंडिंग इन द इंटरमस्कुलर सेप्टा extensions from the deep fascia, which divide the muscles and neurovasculature of the upper and lower limbs into different compartments. Each compartment having their own residents. और वो residents कौन से होते थे? Muscles, nerves, vessels, lymphatics वगैरह. ठीक हो गया. Similar is the case in the posterior abdominal wall. ये जो deep fascia की lining है, ये एक single continuous lining है, और ये some regions of the posterior wall में it is sending septa and hence dividing the different muscles into compartments. जैसे कि अभी हम देखते हैं कि फेशिया जब कवर करना शुरू हुआ, मीडियली अटैच हुआ वर्टेब्रा पे, लंबर वर्टेब्रा पे, और उसने कवर किया इसी के साथ जो बिल्कुल एडजेसेंट मीडियल मोस्ट मसल पड़ा हुआ है, श्वास मेजर मसल. उसके बाद जब वो लैटरली रिफ्लेक्ट हुआ तो उसका नाम हमने चेंज कर दिया और उसे कह दिया थोरैकोलंबर फेशिया. Now you can see कि जो थोरैकोलंबर फेशिया है, it is splitting into at least 3 layers. An anterior layer, ठीक है, ये आपको लेबल करके दिखाया हुआ है, ये anterior layer है, ठीक है जी. Then this is the middle layer and this larger one is the posterior layer. And in between these 3 layers are enclosed the muscles. So Quadratus Lumborum is enclosed between the anterior and middle layers of thoracolumbar fascia, and rest of the deep muscles of the back, जिनमें ये erector spinae वगैरह आ जाते हैं, जिनको post vertebral muscles भी कहते हैं, they are enclosed between the middle and posterior layers of the thoracolumbar fascia. चलें. So medially, the psoas fascia is attached to the body of the lumbar vertebra, whereas the posterior layer of the thoracolumbar fascia is now getting attached over the spinous process of the lumbar vertebra. So that the posterior layer of the thoracolumbar fascia extends between the 12th rib and iliac crest posteriorly. Laterally, this fascia, thoracolumbar fascia, meets the internal oblique and transversus abdominis muscle, but not the external oblique. Transversus abdominis and internal oblique tak ye fascia laterally extend karta hai, so that the thoracolumbar fascia laterally becomes continuous with the transversalis fascia, which is now covering the anterolateral abdominal wall muscles internally and particularly transversus abdominis muscle. So you can see that it is one continuous sheet जिसमें क्या है कि thoracolumbar fascia laterally reflect होके continuous हो गया है with the transversalis fascia, and it extends up till the attachments of the anterolateral attachments of the transversus abdominis and internal oblique, but it doesn't extend up to the external oblique muscle. कोई बात नहीं निम्रा. Also, this fascia covers the latissimus dorsi muscle anteriorly, right? You can see that it is passing anterior to the latissimus dorsi muscle. The anterior layer attaches to the anterior aspect of the transverse process of the lumbar vertebrae, 12th rib, and below up till the iliac crest. Laterally, the fascia is continuous with the aponeurotic origin of the transversus abdominis muscle. Superiorly, the fascia thickens to become the lateral arcuate ligament, which joins the iliolumbar ligaments inferiorly. If you remember the attachment of the diaphragm, you may remember two ligaments which were providing the attachment to the lumbar part of the diaphragm. Medial and lateral arcuate ligaments. Yes, Alia, you're very right. The medial one was arch-like thickening of the fascia covering the psoas muscle, whereas the lateral one was the arch-like thickening of the fascia covering the quadratus lumborum, that is the thoracolumbar fascia. The muscles of the posterior abdominal wall, कितने होते हैं? 5 होते हैं, कम से कम. So the muscles that are present or that form the posterior abdominal wall include the iliacus, psoas major, psoas minor, quadratus lumborum, and diaphragm. All these muscles together form the posterior abdominal wall musculature. Let's take a look at the quadratus lumborum muscle. Attachments of the quadratus lumborum muscle. Quadratus lumborum arises from the iliac crest and iliolumbar ligament. The fibers, they travel supromedially. नीचे से ऊपर की तरफ और medially directed होते हैं, inserting onto the transverse processes of the upper 4 lumbar vertebrae and inferior border of the 12th rib. Quadratus lumborum is supplied by the anterior rami of spinal nerves, T12 up till upper 4 lumbar spinal nerves. Its action includes the extension and lateral flexion of the vertebral column. Also, since it is getting attached over the inferior border of the 12th rib, it also fixes the 12th rib during inspiration.